to do a quick check on whom we have on the call before we get into it. I see we have Brighton Chisha, is Catherine Milimo. I see there's Chiluka from, that should be Western Province Health Office. Dr. Onoya, I see you. Dr. Manzi, I also see you. Helen Mulenga, good to have you. Jackson Ota. I see Kasama General Hospital. Kasama General Hospital, is there anyone close to the microphone so that you just greet the network? I see there's also, this should be Kaumbwe Mini Hospital. It's really, really great to have you join us today. Let me see if I can find a few more people. Yeah, we have 71 connections so far. Is Michael Mubanga, good to see you. Mikhail, it's nice to see you. Msamba, good to have you. Rebecca, Richard Watala, nice to have you all. The time now is 14:30. They have for the year, and we will, we will have a very out of the ordinary session where we will get feedback from the things that, and we'll give you a snippet of what we hope the ECHO program will be in the coming year. That and many other things is what we will discuss. You may notice that today's sessions may be shorter than usual, but basically our interaction is about reviewing the program and how it has run throughout this year. Now, as we get to start, in the chat box every so often, we will be posting a link, which is a link to a survey. This survey is a way of us getting feedback from you on some of the observations you made about the ECHO program, and also for us to get feedback on how you would want us to conduct this program in the coming year. And I could give you a bit of information which I didn't get, but in a few days' time we will be making the curriculum for 2024. And some of the feedback that you will give us through this survey and also through the conversation we will have is what will help us shape the curriculum. Right. So I see that now we have about 100 participants on the call. Allow me to just ask Dr. Ziambo to also just greet the network, and then I'll also introduce the other subject matter experts that will help us in today's session. Dr. Ziambo.
Good afternoon. Thanks, Dr. Singini. It's strange. This year I'm sitting here. I think this should be a second time I'm presenting and I'm not the one facilitating. But it's a privilege just to be able to interact with our network who have grown over the years. We'll be able to show that this afternoon, and that use and utility for the ECHO program has really improved, and people have found it very useful for themselves. And so today we'll just be sharing you some numbers and some of the achievements that we've done this year. So let's just look forward to it, and I will hope to interact with you. Thank you very much. I hope you can see our presentation.
Right. So as I get to sharing the presentation, we will also be supported by the rest of the team members from the ECHO task force. We have from IT Chatonda, and ETA will be Etambuyo will be coordinating this session. And then we'll have Kote as well, helping us on the ICT, as well as Kunda, helping us with the coordination roles. I'll just quickly share the screen and hand over to Dr. Ziambo to take us through the session for today. Dr. Ziambo.
Thank you very much. So my name is Kozia Ziambo. I'm actually the ECHO lead, as well as a chief HIV command from Ministry of Health. And like I said today, I want to just share with you how as a program for information, and so that we may just also pick out some of you what you think and how we can improve this ECHO session. Thanks. So when we started out this year, we had a few objectives and goals that were set out for 2023. We wanted to ensure that we continue with the quality Monday ECHO sessions and according to the curriculum, but of course, adjusting the curriculum to reflect the ongoing needs that we have. And so we also wanted to develop the national and provincial curriculum, and then also wanted to launch the provincial-led Monday ECHOs, conduct the QI assessment visits to all provinces, and disseminate the results of the assessment, as well as conduct the emergent trainings and increase the number of ECHO session participants as we go through the years. So before we proceed, we just bring this down, and just want to thank everybody that has been able to participate, especially our didactic presenters, our facilitators, the case presenters. I think you are the people that have really made this this session and that the ECHO program really succeeds and be a successful feat in what we do. So thank you very much as we proceed. Next slide. So we'll go straight away into some of the achievements, having seen the goals that we had set out. So we've seen ourselves expanding and moving out into the provinces from the central hub. And we can confidently say that we have got 10 provincial hubs that are actually operating and fully fledged with teams that are working in those teams. And this is what we had set out this year to do. And we also have subsidiary ECHOs like the Lab ECHO, the Oncology ECHO, the EP ECHO, which have also been launched and have started going and are doing their sessions. Then also, we've been recognized as a super hub. This has been a great achievement, and as at international in Africa as one of the 3 super hubs, and that and most of Southern Africa, we will be able to conduct emergent training as a super hub. Then we also have successfully launched the provincial ECHOs. I mean, you are witness to this as well. And also enhanced competency in ensuring that our healthcare workers have the necessary skills based on evidence that we share on the evidence-based practices that we share on this platform. And we've used this platform in addressing some public health crises, for example, measles nations, in terms of building capacity and disseminating information. This platform has really played an important role. Further, we've been able to conduct immersions, about 3 immersions, and we've built capacity from different organizations. And the 2 ECHOs that we're very proud of, that we're happy about, that we've spread out to is the Ramcan ECHO, reproductive, adolescent, newborn, maternal health and nutrition ECHO has been launched. We've trained some, not yet launched, but we've trained some people, and that will be starting very soon. We also are looking forward to a Global Reach supported community TB ECHO. It's one of its kind, where we have the community involved in ECHO as well. We've also successfully conducted these weekly and bi-weekly ECHO sessions, which our community, you, the network, have been able to join in throughout. And then also we managed to conduct provincial QI efforts, and we did disseminate the report to all the provinces. We invited them here and disseminated this, and we've been able to just share the results of these findings, and the provinces were very happy about them and are using them to improve their program. So you see in the next slide, we will be talking about the performance of how we have done in terms of numbers. And so we're using the 2023 IACO database. So starting out from 2018 to date, we can see that there's been a progressive increase in the number of people participating from the time when 62 in 2018 and moved up to 2,500, then dipped down a bit to 2,400, and then again went up to 3,900, dipped down a bit, about 3,500. But now we are running at 4,363. And this is something that is worth applauding. So wherever we're seated, we can just give ourselves a hand involved in this project, this program rather. Thank you very much. You have made this program a success. So in terms of the eco clinics, we've also sort of more, because of the way we've approached this year's eco. We do know that the national led echos were about 38, and then we do know that we had some about 34 sessions led by the, I think this is not the one. So here I just want you to see the number of cases and sessions done last year. So we've had about 38 sessions, and we've had about 34 cases. Then advanced HIV disease, we have had about 22 sessions, clinics, and then 11 clinical cases. Then long COVID, about 11. And then SARI, we had about 21. And then we have about 4 provincial-led echo, which has been quite successful for us. We had planned to have provincial-led echoes, and for sure, we had 4 provincial-led echoes. And we are hoping to improve from 4 to next year, maybe 8, so the provinces may be able to lead their own echo sessions. So we will be able to go province by province so that we see who has been attending in terms, and what numbers have been in terms of attendance. So we see Lusaka, the total attendance has been about at 896, and the biggest number of people that have actually attended are the nurses and midwives, about 27%. And then we also have had the clinical officers, and then also the medical officers coming in, and then we also have the HIV nurse practitioners, and another important group to mention. And then we're also happy to see that our pharmacy staff have actually been also on this platform. Then the support staff, this might include the CBVs, the psychosocial counselors, lab, and all that. And then we can move on to the next slide. So Southern Province, we have about 281 number of people that attended. And like Lusaka Province, the nurses and midwives have been the most in attendance. That's at 28%. And then we have the other members at 17%. Then 26% of those have been the medical staff, and then also the clinical officers, about 10%. Then HIV nurse practitioners at 7%. Western Province, we've had a total attendance of 257. Also, in this particular province, we see that the number of clinical officers have actually been the highest at 29%. And the number of HIV nurse practitioners also is actually been quite high compared in terms of proportion compared to the other provinces. And then also we have the nurses at 28% and the medical doctors at 14%. So this one is about is Eastern Province. Eastern Province total number at 206, and we also have the clinic officers as at 29%, the nurses and midwives at 32%, and the medical officers at 18%. Central Province total attendance 116. Well done, Central Province. Here we also have the clinic officers at 29%, nurses at 23%, the HIV nurse practitioners in terms of proportion at 13%, and also the medical doctors at 19%. Copperbelt, good attendance as well, 130. We also know that Copperbelt has had quite some active echo going on in the province. And so in terms of attendance, we have 27% of clinic officers, 12% of the HIV nurse practitioners, and then the nurses at 19 and the doctors at 15. Northwestern Province, and total attendance, we've had 66, and most of these have been clinic officers in terms of proportion. Then you see that also the nurses about 18% and doctors about 9%, and then HIV nurse practitioners at 14%. Luapula, 94. And so I do know maybe some people may be protesting their numbers. But this is data that we've been collecting in IECO, and we do hope that if you're protesting the numbers, perhaps we could improve our data capture in IECO. So Luapula, the nurses have been the highest at 35%, with clinical officers at 26%. On to the next. Then Muchinga also great attendance at 203. And the most people who have attended in terms of proportion are the clinical officers, then the nurses, and then we have the HIV nurse practitioners also coming in. Northern Province, 193. Well done, Northern Province, for this participation. And the clinical officers at 27%, and then HIV nurse practitioners at 24% in terms of attendance. So we also wanted to just dig a bit down in terms of the facility. In terms of facilities, in terms of our facilities, the ones that attended the most is Lusaka. In Lusaka, we have Kanyama Level 1 Hospital. Well done, Kanyama Level 1 Hospital. And then Southern, we have Livingston Teaching Hospital. Eastern, we have St. Francis Mission Hospital. Western, we have Lewanika General Hospital. Central, we have Kabwe Central Hospital. Copperbelt, we have Ndola Teaching Hospital. And then Northwestern, we have Mukingen School of Nursing. And then Muchinga, we have Isoka District Hospital. Luapula, we have Kasanka Rural Health Center. And I think for me, the most here I appreciate is the Rural Health Center, which has benefited and has attended the most. It shows the consistency and been available for these meetings. And then Northern Province. So we want to say that we will be able to produce some certificates of achievements to each one of those that have done very well in these particular sections. And so we'll share this with you all. Thank you very much. So what has been some of the challenges that we have experienced during this process? We do know that turnover of quite high, and new officers coming in. This has been a challenge where we have lost some that we've oriented and trained in ECHO. And also we know that battling internet access in some regions has been quite a challenge. And then also overcoming resistance at the facility level to ensure program uptake. We do know that the staff are overwhelmed with work, and being able to adopt some of this may appear as an intrusion into your usual work, but we also recognize that there's need for continuous capacity building, and hence we've introduced this. We've had challenges in having facilitators to participate in this, and also we do know that some of our health workers are not very confident in presenting cases, and then also dropping out of participants from other spokes, which we noted from our assessment when we did it. And then also we still know that we would like to see a bit more of provincial level ownership for the program. And difficulties in capturing registration. And even as we rolled out the iECHO, we had a bit of difficulties, but now we know that it's been good uptake for iECHO. And then also, we do know that internet bundle challenges exist, and then also the lack of proper orientation of healthcare workers in the facilities. Identified gaps, so we surely hope that they may have a sustainability of a program in the provinces and due to attrition, and try to see if there's non-monetary incentives that can be introduced to help captivate. And then we noticed that the capacity building of provincial team remains as a gap, and the need for improving communication with provincial teams and the ECHO champions at facility level, and then also documentation of participants on ECHO through iECHO. So we want to continue provincial engagements, promote non-monetary incentives, and also continue orientations of healthcare workers on how to run ECHO, and promote also iECHO use. So we would like to recognize some people and some regions. And so here we will be sending out this certificate of recognition. And as we get sponsors, and we engage our sponsors, we'll be able to get a few gifts or shields that we can give these persons. So our top 4 eco-didactic presenters has been Dr. Chitalu Chanda and Dr. Suilanji Sivire. These have really given themselves out and always available to make presentations. And then we've also had Dr. Sinkala Edford, and as always, Professor Mlenga, with so many on his plates, he would still be able to find time to make some presentation. And then we have our top 4 facilitators. With this one here today. So, Dr. Singini. Dr. Naik has been a very faithful facilitator. We thank you, Dr. Naik, not able to be with us today. Our topmost facilitator, Dr. Singini, well done, give us a hand here. And then we also have Dr. Emmanuel Mungomba, thank you very much, and Dr. Muhuma. And we hope our ladies can also rise up to the occasion so that this picture changes, you know. Just, it's not, we really want our ladies to feature as well. So we're looking forward to that. Top case presenters. Now, these are our heroes. These are the people that really make what ECHO is and what we believe in ECHO. Bernard C. Hamanza from Material Level 1. Thank you very much. You have presented the most cases, and you actually go toe to toe. Unfortunately, we said number 2, but it's not number 2. Dr. Patrick Lungu from Kabwe, Women and Newborn, also has matched up to the presentations that Bernard has presented. So we've had the top 2. These 2 have actually gone head to head in terms of case presentation. So I hope wherever you are, you can just put your hands together and just celebrate these 2 guys and for the work that they have done. Then in terms of case submitted, we recognize that there are always cases that are always submitted. Most of you may not come here, but want to recognize the efforts that you make. And so we want to say, Lusaka province, well done for the many cases that you're always submitting. Western province, thank you so much. Southern province, thank you so much. And also Central province, we really appreciate for submission. So we will be able to send some certificates, and if we get sponsors, we will be able to send some awards, recognition awards for these achievements that I've made. We have some special mentions, and this time I'm very happy that we'll actually be talking about the northern region, not only the southern region, which has had ECHO for some time, but southern province in participation and engagement. So kudos to the provincial coordinator, Dr. Jackson, and team, well done. And I know that your team is always comes in handy whenever we want to bring in a case, you always come through. Mchinga province, thank you very much for leading innovation in terms of ECHO. I think you are one of those provinces that has continued to lead the hub, the provincial hub, introducing new things on the provincial hub. So we recognize your work through our coordinator and also the clinical care specialists from Mchinga. And let's give it up to Central Province. This province has been the most improved in engagement, and they've been the earliest adopters in the use of iECHO. They are the only ECHO done the orientations for their staff, and we just want to say thank you, well done, Dr. Lengwet and Dr. Patrick. You've done a very good job. We recognize the work that you're doing. So having presented, this is where we are on in the ECHO program, and so we look forward to seeing you in 2021. And so, unless there are any comments, questions, reflections that the network has, I'll hand you back over to Dr. Singini. Thank you.
Right. Thank you so much, Dr. Ziambo, for that very interesting oversight of how we have fared in the past year, and special recognition to the people that have made ECHO what it is today. We cannot overemphasize the role that you, the network, has played in this by simply asking us those questions during each session, and challenging us to put in innovations that work for you. When looking at where we're coming from, we've tried several things for data capturing. Those that have been attending ECHO long enough, you remember the days of using QR codes for registering. We got feedback from you to say, this is not working for us, let's try something else. And we have adapted as the years have gone. And this is evidenced also by the number of participants we are seeing. On average, back in the days when we reach 100, we would be celebrating here in the hub. But now we do get sessions where you have up to 800 participants joining in at each particular time. And that doesn't include those that sit in congregate settings. So it's just testament of how ECHO has grown over the years. And we thank the entire network for having been with us all through these sessions. So maybe for now, allow me to give an opportunity to you, dear network, to have your say. Would like to get some feedback from you in line with you would like more things that you'd like to see on ECHO, so that even as we make this program much better, we will be guided by what works for you. So I'll start by asking that those that may have submissions will just indicate to us by raising your hands, and others may be sending their feedback through the chat box. So anyone with comments, additions before I start asking some of the subject matter experts to share their experiences implementing the ECHO program? So I'd like to start with the network. All right, so, well, yes, I see there's a hand from Lukulu, that's Western Province. Lukulu, please go ahead and unmute and give us your submission.
Good afternoon.
Good afternoon.
This is Lukulu from Muchinga, not Northwestern.
Oh, okay. Please go ahead, Muchinga.
Yes, I had a challenge sometimes when it comes to joining the meetings, especially when it comes to the registration. I did the registration sometimes back, but when it comes to the joining the meeting, it's requesting me to register again. When I register, sometimes it refuses to join it. So you may observe that some days or some meetings Lukulu was not able to participate in the meeting due to the same challenge.
Right. Thank you for that submission, Lukulu. That's helpful feedback. I will ask someone from our IT section to just respond to that in a short moment. But is there any other submission from any member on the
in progress?
Elvis, submission. All right, Elvis, I see Moleya has unmuted. Is this accidental? Or please go ahead with the submission. All right, so I'll ask Chatonda, maybe we could start with you to help us respond to some of those issues pertaining to registration, where the registration link has been sent, but our colleagues are struggling to actually access the link to join the meeting. Chatonda.
Okay, thank you so much. And thank you so much, Lukulu, for that important question. Please believe me, this isn't just unique to Lukulu, but there are a couple of individuals who've been experiencing this challenge along the way. So please note that we have transitioned to the new IECO. So there are a few hiccups that we are facing in terms of participants and groups joining. But we are still working on this, and I will send you in my contact in the chat so that we can see how I can help Lukulu, because it will also be important to know what exactly the challenge is. I know we've had various challenges in terms of joining IECO, but thank you for that feedback, and we'll definitely continue to improve. Thanks.
Right, thank you so much. And Chatonda, before you go, and I've seen there's a hand from Kelvin Chishala. Maybe let's have the hand from Kelvin Chishala. Probably both questions may be directed to you. Kelvin.
Thank you very much. Good afternoon, Doc. Nice to see you.
Good afternoon. Good to see you.
Thank you. For me, to start with, I want to actually say thank you for the commitment from the team from that side. I think it's not something which is easy. You're always making time to ensure that the information, the latest updated information is shared amongst staff in all these facilities in Zambia. We are grateful for your commitment, Doc, and the team. Just one thing I would raise for you maybe to reconsider is, I don't know how you look at Monday sessions. I feel we could have more numbers if maybe we pushed the Monday ECHO session on a day which is not very busy. I think that Mondays are quite very busy. People are in the meetings, and then later they want to settle and work. and do one or two things. So the attention is usually divided. So I don't know, I know it is not an emergency, but something which you may try to look at in the near future. If we can have a day, for example, like Tuesday, where we can be having these first sessions, and then we maintain Thursday, as you have put it. Thank you very much.
Great submission, Kelvin. Definitely worth looking into. And I will have Dr. Ziambo respond to that particular concern in a moment. And I've also taken note of hands initially from Chimwemwe Zulu and Eliud Jameson. So before I ask those two to give us submissions, let me just ask Chetonda also to respond to the question that is in the chat. I think it's one of those very, very important questions which we need to address as soon as possible. And this is coming from Mushaukwa Muyangana, who's saying lab staff were not represented on the proportions of attendance. Is it low attendance or was it an omission? So Chetonda, would you like to speak to that?
Thank you so much. And thank you for the keen eye from our colleague. So unfortunately, we couldn't put all the cadres on the list. So what we did is if your cadre wasn't on the list, we had put them as support staff, because it would have been, the graph would have been very complex to include every cadre. Otherwise, they were not admitted, but they were under support staff.
All right. So thanks for that, Chetonda. I saw there was a hand from Chimwemwe Zulu. Chimwemwe, if you still have that comment, please go ahead. Before I ask Eliud Jameson, I hope I've pronounced that correctly. Chimwemwe.
Okay. Good afternoon, Dr. Singini.
Good afternoon.
Okay, thank you very much for the opportunity. Just to thank the team once more for having these great echo sessions. Personally, I've learned quite a lot from the sessions. Also, maybe one thing I'd like to add is that I've personally benefited from the YouTube channel where most of these echo sessions are recorded. So I think it helps for, some of us when we are too busy to log in, we're able to still catch up later on. What I'd also maybe just ask is a bit more consistency on uploading most of the videos. Some may not be there, but I must say those that are there are very helpful, and we're able to catch up at a later time. As someone else earlier mentioned, sometimes Monday may be a bit too busy, but still, I think we appreciate the lessons learned and just sharing information. So kudos to the team. Thank you very much.
Thank you so much, Chimwemwe, for that. Eliud, please go ahead, and then we'll respond to the earlier question by, rather comment by Kelvin.
Yeah, good afternoon. Good afternoon, Doc. Good afternoon, everyone. Yeah, first and foremost, I'd like to appreciate the team for the great job that you put in, especially on and also on how you respond to a lot of emergencies, especially like earlier we had cases to do with anthrax and those that are pandemic that may arise. Yeah, we appreciate so much. Yeah, and I had two queries. One is just that, like earlier commented, the uploading of videos. Yeah, so that at least if at all you missed the session, at least it's easy for you to catch up, because not everybody may catch up during the day. Some may even go, maybe you want to catch up maybe at night or early in the morning, so that will greatly help. Then the other one, I just wanted to find out concerning the certificates, if at all certificates are offered, because asked a number of their colleagues, some have received it, others in some sessions, of course. So I wanted to find out, especially the arrangement concerning the certificates, and also how easy it can be for one to acquire one, especially on a number of the sessions that we usually have. I submit.
Thank you so much, Eliud. That's very, very important submission regarding the way we've been implementing the ECHO program. And really some of those are areas of improvement for us here at the Hub. But, you know, as I invite Dr. Ziambo to respond to the question earlier about the timings of the echo session, and, you know, briefly also speak to the, in part, could speak to the uploading of the video, consistency in uploading the videos, and then I'll ask Chatonda to also speak briefly to the uploading of videos, and also talk to some of the submissions from Kelvin. Dr. Ziambo.
Thank you very much. So the day has been quite a difficult thing that we've had. I think maybe we could have highlighted in our challenges, because it's very difficult to come up to works for everybody. But I think with your submission, we will be able to engage the different levels of leadership. And then also, I think we've sent out a survey, evaluation survey. Please complete that evaluation survey and tell us what we need to change. There is a provision there where you know, what would you like, what would you want us to, what ideas would you suggest? So please complete that survey. It's in the chat box. Go there and just add that we need to move to Monday. Once with that information, we can actually engage different leadership through the Director of Clinical Care and Diagnostics, show leadership. Then we can agree on a day that suits and works best for everyone. So I think that's how we'll proceed with that particular.
Right. Thank you, Dr. Ziambo. Chatonda, briefly speak to the consistency in uploading the YouTube videos, or rather the videos to YouTube.
Thank you so much, Dr. Singini. I'm actually glad to hear this concern from a lot of people. So this just shows that our videos are being watched. So we're really grateful for that. So there are a few videos, yes, I admit, that have not been uploaded onto YouTube. One of the main reasons is internet. There are times when, you know, you start recording, then you drop off, and so it becomes difficult to upload such videos. But we have taken note, and we will try to be as consistent as possible in terms of uploading the videos. Thank you so much.
Right. Thank you so much, Chatonda. You know, I know one of the things we've learned from the echo session over the years is that echo sessions that have got a case being, you know, having a case presentation are the ones that are enjoyed the most by a number of spokes. And so I'd like to invite our echo coordinator, Etambuyu, to just give us a few insights on how it has been trying to get, you know, some of the cases from the provinces, and also share some, you know, ways in which we can enhance participation from the network, from the experience that we've gathered so far. Etta, are you able to take that one for now? All right, so while we are waiting for Etambuyu to set up her microphone, I see there's a hand from Kelvin Chishala from Chinsali. Please go ahead, Kelvin, with the response.
Thank you, Doc. Once more. This one may sound a little bit controversial, but I hope you understand the point I will try to drive out. We will need to appreciate and understand that this platform has really been helpful in terms of the way information is actually delivered. But in my experience, as I've been attending the sessions, like you have just highlighted, Doc, as you're trying to give to Madam Etambuyu to explain one or two things, I think the way the information is disseminated or is given on that particular day, it gives a certain vibe for people who are listening. You know, when you're not seeing the person presenting and everything, there should be something to actually draw your attention to listen and just have that interest to follow through. So we've had different facilitators coming through, if I can call them that. Sometimes you'd have those who are just like running through, just reading through slides. So like that becomes a little bit boring. But we've got again others when they are reading through the slides, but they add some meat to what is being explained. So if that can be taken into consideration as we invite different facilitators who are coming through to give us the information, let them be considerate on that one, because reading through, everybody can do that. And I think that's not the reason why we log into this. We want that extra explanation which will make someone grasp what is being spoken about. That would actually help them and make them remember even if they don't have notes. Thank you very much.
Excellent, excellent submission. And, this is directly going to the ECO Task Force as we engage our subject matter experts to come and make this presentation. We need to foster the approach of making each session interactive. Tailor the information, have a way of interacting with the network to improve participation, because I think from experience, it also improves the attention of the people that are listening to us. I think I won't ask anyone to respond to that, but just to acknowledge that that's a point well noted, and we will.
Very important.
Yeah, we will definitely act on that. And, one of the things that have been done by the task force is to do some capacity building activities for lack of a better term, to teach in a virtual meeting like this one. Just last week, when we were launching some program, we had a session where someone was, giving a talk on how to facilitate an eco session. It's not necessarily just speaking and reading slides, if I could, but it's a way of engaging people. Right now, people may be wondering, it's just me and Dr. Ziambo sitting in this big room in front of 3 screens and a camera. So you may get carried away and forget that speaking to hundreds of people in different parts of the country, and you become monotonous and forget that fact that you're dealing with a lot of people that are actually seeing and hearing you. So, it's work in progress, and we appreciate that has actually come out from you, our network. Etta, I think now you could be ready to respond to the question that was directed to you.
Thank you very much, Dr. Sangini. Good afternoon, network. And allow me to congratulate everyone for the job well done. Even those who didn't appear on our mentions as the talk facilitators, you are helping and making the work better. And we hope next year we can see you on the list. So back to the question, cases are very important during ECO sessions. We really need them. Actually, the third principle for ECO talks about case-based learning. So we want to have these complex cases. We want to share best practices. So it doesn't necessarily mean if you don't have a case, you can't submit. No, sometimes you could have had, as a facility, you had a complicated case, which you managed to do well. Remember, everyone connects from the entire nation. So we also want to share best practices. So people can share those cases which they did manage to do well, they handled those cases well, but also they should also bring in complicated cases so that you put these experts to use. These are the experts who are there to share their knowledge, their skills. They want to transfer the skills that they have to the healthcare workers across the country. So my appeal to everyone on the network is, please, let's keep on submitting these cases. And also, let's try to encourage. You've seen on our top case presenters, there was a doctor, there was a clinical officer. Personally, I would love to see even nurses, the pharmacy staff, every other healthcare worker to come through and give case presentations. That will be building capacity in everyone. I think that's all. Over to you, Dr. Singini.
Thank you so much, Etta. And you know, I deliberately asked Etta to turn on a video because most of us have seen us send us emails and WhatsApp messages, but you don't know the face behind it. So we want to eliminate this issue of like you are just interacting with your machine, your computer. Know that, you know, there's people behind the scenes, you know, in
Artificial intelligence.
exactly. We're not dealing with artificial intelligence, you know, respond. There's actually people that are involved in the whole thing to work. You know, I also want to just ask Chatonda to also just mention something. There was an issue of the certificates. I saw in the chat box someone indicated that they wanted to find out how they could access the certificates of attendance for, you know, when they attend an eco session. Chatonda, maybe you could give us a quick run through on how you could you know, you could access those videos, or rather those certificates.
Thank you so much, Dr. Singini. And my apologies for not responding to that earlier. I think I forgot about the question. So the issuance of certificates. I know once you have pre-registered your attendance on the new IECO database, you are already in the system. And after the pre-registration is done, every other time you join the session, your registration is linked to the database and it automatically updates. So in short, depending on the number of sessions you've attended, using IECO, the link that we share, you can access your certificates. Please note that issuance of certificates is only through the use of the IECO platform, and that's why we have been encouraging the use of the link instead of the direct Zoom link, because once you join directly, you will not be able to get your certificate. So now when it comes to how to access the certificate, you can access the certificate. Maybe I can just quickly share. I think it's easier to just show. My apologies, just a second. Okay, so this is my dashboard for IECO. So you can see that once you are pre-registered, IECO has a database of each participant. So when you go to your top right-hand corner, like there's my name, you click on that drop-down arrow, then you'll be able to view the certificates. Unfortunately for me, I haven't accumulated any certificates because I'm in admin, so apparently admins cannot be issued with certificates as of yet. But I think for everyone else, when you click on the drop-down arrow and view certificates, you'll be able to see the certificates accumulating. Please note that certificates are issued manually, so there may be times the uploading of the certificates may take a couple of days. Sometimes we have backlogs, yes, but at some point everyone should be able to access their certificates. Thank you.
Right. Thank you so much. You know, in the next, rather, you know, about 5 minutes or so, allow me to also just ask the last few people to give a few comments, and then we'll wrap it up. Like I mentioned, today's session will keep it short, keep it simple and straightforward, as a way of getting feedback from you, our folks. Now, this is also another person that's been playing a key role in the ECO program, and her name is Kunda. She's been, some provinces were having low numbers of participants, and I believe, like, you know, that must have been Wapamuchinga. They may be asking, say, but we do have a lot of our people participating. How come they have not been captured? You know, could you just briefly speak to the data capturing and how we aggregate this data, you know, for us to present it the way it was presented earlier on by Dr. Ziambo? Kunda, brief comments? Okay, we seem to be struggling to get Kunda online. But once she's ready, we will get back to. Yes, please go ahead, Kunda. You are currently muted, so we can't hear you if you're speaking. So Kunda is going to join ETA. All right, great.
So good afternoon, everyone. Thank you so much for a very interesting and successful year. It was great having you all on board. So concerning what David said, some people having connected and yet they're not showing. Yes, and yet they're not showing in the registers. So mostly these are just issues to do with the old system. Yes, you needed to register on your own, but then now the new system, just you logging in, it means your attendance is captured. So again, the issue that we have for now is that not everyone is logging in successfully. We have people that are failing here and there, but these things will be cleared with time because it's a new system. So you don't expect things to just work out for everyone overnight. So we are thrilled to have everyone, and on this system, we hope that in the coming year, we'll have none to no problems at all. Yeah, thank you.
Thank you so much, Kunda. Great to have you come out and give us those comments. Network, I'm doing this deliberately just to show you that there's a lot of work that goes on in the background to get this to work. But, we're very, very excited to actually do this every Monday, every Wednesday, every Thursday, just to get to, contribute to the capacity building activities that the ECHO platform does. Now, one other person I'd like to call upon, and she's the person that introduced me to ECHO some 2.5 years ago, and in a way nurtured me to become this person who's speaking to you today on ECHO. And this is Auntie Nomsa. We like calling her Auntie Nomsa, but her full name is Nomsa Siamwanza. Auntie Nomsa, just a few remarks on how the ECHO program has grown from the time it was started, when you were among the leads starting the ECHO program to what it is today. Just a few thoughts and a few words of encouragement from your end as we wrap up today's session.
Wow. Thank you so much, Dr. Singini. I didn't expect to speak, but we are so excited. We are so grateful for everyone that has been participating on ECHO. And basically, this is a capacity building platform. So we are happy to have everyone take ownership and also be part of this network. But one thing I want to encourage the network out there is that let's get the people that interact with patients on a daily basis, because our experts take time, to prepare for these sessions. And it's a waste of time and waste of resources to have our healthcare workers that may have challenges that are not participating. So we have seen this network grow and it has added value. There are different testimonies from different individuals, but the ultimate goal really is to touch that particular patient that has the right to receive quality care. And so when we have safe providers, we know that the patient outcome will also be positive. So I will only say thank you so much, and we appreciate everyone. Encourage someone that doesn't participate and just share the benefits of this being part of this network. Sorry, I had a hoarse voice today, but I was not expecting to speak, just excited to see how this program has grown. Thank you so much and have lovely festival season.
Thank you so much, Auntie Nomsa. We really value your contribution to this program. As I prepare to ask Dr. Ziambo to give us his last remarks for today's session, Allow me to just mention that I'm very thankful to the ECHO program for what it has achieved so far and the heights we have reached. But I'm also excited about the heights we're going to reach in the coming years with the momentum that we've gotten up to this point. There were a few names that were on those screens, yes, but that's also just for us to mention that there's a lot more people that are contributing to the success of ECHO, way beyond what our screens can display. And so we'd like to thank all those individuals. And, you know, allow me to, at this juncture, just ask Dr. Ziambo to give us his final remarks following that presentation he made, and also to close this feedback session.
Thank you very much, dear Network. As always, we are here because of you, and we're here because of your participation and your involvement. As you all know, the principle of ECHO is all teach, all learn. I learn even as I come on this platform, and I also get taught by your presence, and it's the same way, vice versa, it works. And so we want to continue with the spirit, even as we take a break for the next 3 weeks or so. We are going to come back in the second week of January, when we launch our ECHO sessions. And we are looking forward to your feedback, as we have shared in that survey form. Please complete that survey form so that we use that information to actually generate our next curriculum for next year, which will be relevant and speaking to your needs. So thank you very much, and it's been a great year. So you can just put your hands together and just clap your hands for the success that you have contributed to this session. And that will be bye for now.
All right, thank you, Dr. Ziambo. Thank you, Network, for joining. Wishing a happy festive period. Yes, let's hear more of those claps. If you can, turn on your video and show us yourself clapping. Yeah. Great. Chinufia, we are seeing you. Right, Kelvin Shala, we see you. Mungomba, we see you. Chimwemwe, we're happy. Stali Mubika, Namakao, Komena, Dr. Muhuma, Akufuna. It's amazing. Dr. Chitalu, nice to see you. Dallas Ndilwa, great to see you. Thank you so much. Mutukwa Muyongo, awesome. Lukulu, as always, ever shining. We're seeing you. It's been amazing. Thank you so much. There's several other people that have joined in. Patson Mwanga, I see you. Great to see you. Lewis Mushota, Mikel, Chipo Kalabo. You know, it's awesome to see you joining us today. Otherwise, thank you all, dear Network. Have a happy festive period, and looking forward to you joining us when we restart the ECHO sessions for 2024. Thank you and have a good day. Bye.
Thank you.